If you're on Social Security benefits and you're still working, pay attention. There are new 2025 rules that you must follow in order to continue to get your full benefits. I'm going to explain this in details. If you are receiving benefits before your full retirement age, these 2025 rules apply to your benefits. And if you go over these thresholds, you are going to lose some of your benefits. And then I want you to watch till the end of this video, because if you're on Medicare or you're turning 65 and need to sign up for Medicare, I have great news for you, including how to save $1,100 a year on your Medicare costs. I am Kwame Kwade. I am an entrepreneur and personal finance expert. For 15 years, I've been creating content to help seniors get the retirement benefits they deserve. We started with websites on Social Security, Medicare, food stamps, and more. And now we've added video content to bring you the latest news updates. I'm also an adjunct professor. I teach finance at one of the most prestigious universities in the United States. So if you're new here, hit the like button, hit the subscribe button, because we appreciate your support. And as always, I want to know where you're watching this broadcast from. So do me a favor, go into the comments and give me your city and your state. So let's get started with this 2025 rules that govern Social Security while you are working and claiming benefits. What are these rules that you must pay attention to if you continue to work and collect benefits? Well, the annual limit, the earnings test for 2025 is $23,400 for those under full retirement age. Social Security would deduct $1 in benefits for every $2 you earn above this limit if you haven't reached your full retirement age. This is so important. In the calendar year you reach your full retirement age, the limit increases to $62,160. And for earnings above this limit, Social Security will deduct $1 for every $3 you earn, but only counting earnings before the month you reach full retirement. And then after you reach full retirement, you have no limit. You can earn as much as you want and your benefits will not be reduced. So what is considered income under this earnings test? Well, only income from work counts towards the earnings limit, which includes wages, self-employment income, bonuses, commissions, and here's the thing: pensions, investment income, interest, annuities, and other government benefits do not count towards your earnings test. So how are benefits reduced? Well, if you expect to exceed the earnings limit, Social Security would withhold monthly payments at the beginning of the year. They calculate the total withholding needed and suspend your monthly payment until the amount is covered. Now you have some reporting responsibility here. This is how a lot of people get in trouble with overpayment, because they don't comply with the reporting requirements that are necessary when you're working and claiming Social Security under your full retirement age. You should report your expected earnings to the Social Security Administration to avoid overpayment. Overestimating your earnings is better than underestimating, as underestimating may result in you owing money to the Social Security Administration, which I don't think you want to do. Now, in the first year you receive Social Security benefits, Social Security will apply a monthly earnings test if you retire mid-year. This special rule allows you to receive full benefits for any month your earnings are below $1,950 for 2025, regardless of your total earnings for the year. Now, there's an adjustment process after the tax year ends. Social Security will receive information about your earnings and make necessary adjustment. If too much was withheld that year, based on your estimate, you'll receive the difference back. If too little was withheld, you will need to pay back the excess. So who is affected by the earnings test for 2025? Well, early retirees. The earnings test applies to anyone who collects Social Security benefits before reaching full retirement age. The full retirement age ranges from age 66 to 67, depending on your year of birth. And then those getting spousal and survivor benefits also have to comply with this rule. The earnings test also applies to spousal and survivor benefits. If you are receiving these benefits before your full retirement age, your work income can reduce these payments according to the same limits and formulas that I explained before. Now, working spouses need to pay attention to this. If you're married and your spouse works while you collect benefits, their earnings don't affect your payments. The earnings test is applied individually to each person receiving benefits and not to household income. That's a critical point to make. And then disability recipients, this is what you need to know. Different rules apply if you receive Social Security disability insurance. In 2025, you can make up to $1,620 per month and $2,700 if you're blind without affecting your disability benefit, as those have separate substantial gainful activity. If you're on disability benefits and you want to avoid overpayment, you need to pay particular attention to that substantial gainful activity limit. That is how a lot of people on disability get in trouble with overpayments, and then their benefits are canceled, and the money is used to repay the money they owe until it's paid off before their benefits are resumed. Now, you're going to get a credit letter if they took too much or they did a recalculation and are giving you money back. When you reach a full retirement age, Social Security will recalculate your benefits amount to give you credit for months when benefits were reduced or withheld due to earnings. This means that most or all of the money they withheld due to the earnings test will be returned to you over time. And then there's a permanent increase as a result. The recalculation essentially treats you as if you had claimed benefits later than you actually did. If you lost 12 months of benefits to the earnings test, your benefits will be recalculated as if you claimed benefits 12 months later than you did. Now, working longer definitely helps your Social Security benefits situation. Continuing to work may increase your benefit amount if your recent earnings are higher than your previous earnings. Social Security calculates your benefits based on your 35 highest earnings years. So replacing lower earning years with higher ones can boost your benefits. So what this means is that when Social Security first calculates your benefits, if you retire, let's say at 62, they're going to take your 35 working years and then pick the top, the top earnings for 35 years. So when you continue to work after you're receiving Social Security benefits, if you're making more money than any money you made during those 35 years that they used to calculate your original Social Security benefit amount, it means that you're swapping lower earnings years with higher earnings years that you have gained when you started receiving Social Security and continue to work. So that naturally then increases your benefit amount when they do the recalculation. Each year, Social Security automatically reviews the records of all beneficiaries who had wages in the previous year. If your latest year of earnings is one of your highest 35 years, which I just explained, they will recalculate your benefits and pay any increase retroactively to January the following year. Here are some practical things to think about. If you plan to work while receiving Social Security benefits before your full retirement age, estimate your earnings carefully. Consider whether it makes financial sense to claim benefits early if your earnings will cause significant benefit reduction. It means that if you're going to continue to work and get Social Security and you're going to work a lot and make a lot of money, it's going to reduce your Social Security benefits. So does it make sense to even collect Social Security now when the work you're going to do is only going to make your future benefits higher? That's a decision you have to make. In addition to the earnings test, working while receiving Social Security may increase the portion of your benefits subject to income tax, which is true. Up to 85% of your Social Security benefits may be taxable depending on your combined income. That's another thing you have to think about. Medicare consideration. Working past age 65 can affect Medicare enrollment decisions. If you have health insurance from your employer with 20 or more employees, you may delay medical enrollment without penalty. Self-employed individuals have the same earnings limit, but only net profit is counted towards the limit. If you own a business, setting strategies regarding timing of income and expenses may help manage earnings test impact. These are some things you need to think about for 2025. The first one is know your full retirement age. Your full retirement age depends on the year you were born and ranges from 66 to 67. Knowing the exact full retirement age is crucial for understanding when earnings limit no longer applies to you. And then there's the monthly versus the annual test. For beneficiaries, or for most beneficiaries, the earnings test is annual, but in the first year of claiming benefits, you may use the monthly test. And the monthly test allows you to receive benefits for any month you earn under 1,950, regardless of your annual earnings. And then it's important to keep documentation, keep records of your work earnings and any communication with the Social Security Administration about your expected earnings. Good documentation will help resolve any discrepancies or questions about your benefits. And then finally, consider delaying benefits. That's a financial decision you have to make with your financial planner. If you are still working with substantial earnings, consider delaying Social Security benefits until you've reduced your work hours or reach full retirement age, because that must be more advantageous to you. Each year you delay benefits after full retirement, you increase your Social Security benefits by 8% until age 70. So here are 5 things you need to know. Number 1, your 2025 earnings limit is 23,400 for those under full retirement age, is 62,160 if you've reached full retirement or the year of your full retirement, and only income, working income, your wages, self-employment income are going to count towards the earnings limit. Pensions, investments, and other non-work income do not count. And then there's benefits reduction. Social Security withholds $1 for every 2 you earn above the limit. In the year of your full retirement, it's more generous, $1 for every 3 you earn above the limit. And then once you reach full retirement, nothing is withheld. You can work as much as you want, but then you're also subject to Social Security taxes on your Social Security earnings. And then, as I mentioned, money withheld due to excess earnings isn't lost forever. Your benefits amount will be recalculated and increased when you reach full retirement age. Now, let's talk about Medicare. For those of you who are turning 65 or you're currently on Medicare, are you on the right plan? Well, here's the thing: 90% of seniors are in the wrong Medicare plan. And let's talk about that. And there is so much activity happening with Medicare in the news, people losing benefits, benefit plans being dropped in certain states, and hospital networks dropping certain plans. It's endless. And so you see scary headlines like this from the Center for Economic and Policy Research. So what does that mean for you? Well, here's the thing: if you're turning 65, you need to enroll in Medicare. 3 months before you turn 65, the window opens for you, and then it runs through 3 months after you turn 65. If you're currently on Medicare, getting on the right plan is important, because finding the right plan for you, your budget and coverage, can be frustrating because there's so many options, restrictions, costs, and you need to consider your own needs when picking a plan. So it makes sense that 90% of seniors end up in the wrong plan because there's 24,000 plans to choose from. How do you figure all this out? Well, we have help, free help to you through our partnership with Chapter Medicare. These guys are free, a free service. They are unbiased, and they can help you sort through the 24,000 plans and see what fits your need, your budget, and personalize a plan that is unique to you based on the coverage you need, how much you're willing to spend, and most importantly, your doctor network and prescriptions that you need. Now, why are we partnering with Chapter? Why? What's special about them? Well, three things. First one is that they can save you money. They can save you $1,100 on average a year, which is a lot of money, especially when you're on fixed income. And then one of the most attractive things about Chapter is that their licensed agents are not working for commission, unlike other companies. So they are not there to sell you expensive plans just to get commission. They're there to focus on your needs and align plans that meet your health needs and your budget. And then here's the biggest: they are the only Medicare advisory company with access to all 24,000 plans. So they can look in your local area and figure out what plan fits your need. But you have to call them now. There's a small window if you're turning 65 or if you are currently on Medicare that you can switch to a better plan. So call them at 539-205-2147. Or in this video, we're going to put a link in the description and you can click on that link and fill out a form. It's a quick form, and then Chapter will reach out to you and help you get on the right plan. Avoid being one of the 90% that are on the wrong Medicare plan. These guys are the real deal. As you can see, lots of 5-star reviews, A plus with the Better Business Bureau, and they can save you $1,100 or more. Lastly, if you're new here, you don't want to miss our updates on critical things that are happening with your retirement benefits, Social Security, Medicare, Medicaid, food stamps. We want to be the first to bring it to you. The only way to guarantee that you're going to get up-to-date information is to sign up for our newsletter. And then you have to go to this website, benefitsinsider.co/subscribe, and sign up for it, or look into the link in our video description on YouTube. There is a link there. You can click on that link and sign up for our newsletter. So what do you get? Well, the latest news and updates, and then money saving discounts, and anything in and out of Congress that's going to affect your retirement benefits. We want to bring it to you. Join thousands of people who have signed up and are going to be getting these updates on a regular basis. So sign up to our newsletter today. And that is pretty much what I have for you today. So until I see you tomorrow in our video, thank you for watching.